Probably the biggest fear most of them have is just fear of surgery itself. And so most of the time, I can put them at ease quite a bit because the odds are we're going to be able to get them better without surgery. You know, if you look at all spine conditions, about 90% of people will get better with non-surgical treatment. And so if they've already sort of exhausted what we call conservative treatment or non-surgical treatment, and they're kind of at that point where they really do need to consider surgery, then I just try to put them at ease and explain to them, you know, the surgery itself in detail and how we're going to do what we need to do. The fact that for the most part, the vast majority of the surgeries are very safe. And if there are specific complications that they might be at risk for, then we try to identify those and minimize them. I try to put myself in their shoes as much as I can. A lot of these patients are in a lot of pain. Some of them have been in a lot of pain for a long time. And spine issues, you don't always, it's not like a big swollen ankle where everybody knows you're hurting and you're limping around. Spine pain is a little more hidden, and so sometimes the people around them aren't necessarily as sympathetic to someone with a spine problem, even loved ones, as someone who has a big swollen ankle or something that you can obviously see that it hurts. And so I try to be as patient and as empathetic as I can with them. And then I try to treat them like I would like to be treated. My favorite part about my job is helping people get their lives back. It's one of those things where you hear about immediate gratification versus delayed gratification. A lot of spine surgery is immediate gratification because you have a patient who's, you know, on pain medicine, or, you know, I had one patient literally that the first day I saw him, he was on his hands and knees in my office because he had a huge disc herniation. The muscles to his legs were barely working. He couldn't stand upright. He kind of his wife helped him get into the office door, and then he literally was on his hands and knees because if he stood up straight, he was in too much pain. And it doesn't happen very often, but I took him, after only knowing him for 5 minutes, took him straight to the operating room, and the next day he was up walking around just like he'd never had anything wrong. So things like that are just very, very satisfying on a personal level.